Okay, my topic for this week is metered dose inhalers, or MDIs. So first we're going to talk about what they are. So metered dose inhalers are handheld devices that are given to kids with respiratory disorders so that they can self-administer medications. So metered dose inhalers are indicated for any respiratory disorders that call for or necessitate bronchodilators or corticosteroids. And so here's just a quick picture of what an inhaler looks like. This is the mouthpiece. And in here is where all of the medication is stored. And so there are different steps to using a metered dose inhaler, which we are going to list out here. So first, the child is going to remove the cap. That's going to be on top of the mouthpiece, and you just remove it, and so you can have that open. And second, they're going to shake the inhaler. So you're going to shake it up. The ATI textbook says 5 to 6 times. You just want to tell the child to just shake it up good so that the medication moves around. You can then attach a spacer if that's indicated. It's encouraged to have a spacer so that there can be proper inhalation of the medication. Not all the times is there one. And then you're going to instruct the child to hold the inhaler with their thumb near the mouthpiece and their index finger and middle fingers at the top. And so using the picture of our inhaler over here, I'm going to draw that. And so there's a quick picture of the thumb towards the mouthpiece and the index and the middle fingers towards the top, and that's how you should instruct the child to hold the inhaler. And then you're going to teach them how to actually inhale the medication. So there's 2 methods. We'll write these out. So the first one is the open mouth method. And so here, you're going to instruct the child to hold the inhaler 1.2 to 1.6 inches away from the mouth. And with the closed mouth method, the child is going to place the inhaler between their lips, so right on the mouthpiece right here, and form a seal around the inhaler. And then you're going to instruct them to, very important, take a deep breath. And so this is when they're going to breathe in the medication, and then you're going to instruct them to exhale. And so when this happens, they're going to press the inhaler to deliver a dose of the medication, and before they exhale, they're going to hold their breath. And this is important to instruct, hold their breath, because they're going to hold their breath for 5 to 10 seconds before taking a big exhale. And so after that first puff, as it's called, we're going to write that down. So that's when you get the first dose of the medicine. If an additional dose is needed, you're going to wait 1 minute in between administration before giving another dose. And then afterwards, you're just going to tell them to resume their normal breathing pattern. So when we talk about the nursing actions for metered dose inhalers, really the nurse just has to ensure that the child uses the inhaler with the proper technique, which we went over. And so you can do that in a client teaching session. And talking about client education, you need to reinforce the proper way to use the inhaler with both the child and the family members, so that if they need to refresh the child's memory, that they're able to do that. And then just getting into the different complications that can occur. So they can breathe in a little too fast, and the inhalation is just a little too rapid. And so also they could not be holding their breath long enough after that first puff with the medication. They could just be, exhaling right after, and that's not what we want. We want to hold it again for 5 to 10 seconds before taking an exhale. And really big are fungal infections. So using a metered dose inhaler with corticosteroids can actually cause an oral fungal infection, and so you actually need to tell both the client and the child, the parents and the child, instruct them how to clean the inhaler to make sure you don't have any of those that bacteria on there. You have to clean it after every single use. So let's write that down. So between every use, you're going to be cleaning that metered dose inhaler, and you're also going to rinse out the mouth. To try to, try to limit the amount of fungal infections that occur, make sure none occur. So it's just a quick overview of everything that we learned about metered dose inhalers, or MDIs. So it is a handheld way for administration, for children to be able to self-administer their medications, bronchodilators or corticosteroids having to do with respiratory disorders. It delivers a puff of medication, and additional may be needed. Now, very important, between the two puffs, you're going to wait 10 seconds. Not 10 seconds, I'm sorry, 1 minute. 1 minute between both of them. Now, once you're done taking those puffs, you are going to clean the inhaler between every use and rinse out the child's mouth. So those are just a couple of the important parts that we hit on metered dose inhalers. All right, and that's the end.